How many people are being treated there at any given time?
Well, right now, they usually have about 150 men who are being treated on a regular basis.
Daily?
And they come in and out. You know, one guy's finishing, another guy comes in, and you start off with you're a newbie, and then you work your way up through the line. But anyway, so you have a treatment every day. I had 44 treatments, so I was there for about 2.5 months, and on my weekends I was free. Now, after each treatment, well, a typical treatment was I'd go in to the center, and I'd have to drink about 16 ounces of water. That was the first requirement. Then I'd wait for them to call my name. Then I would change into a gown, go in. They would lay me down in this thing called a pod. Now, first time when you go out there, they create this thing called a pod for you. And what it is it's kind of like an open canoe. They lie you in this canoe, and they build a mold around you.
A body mold?
It's a body mold. And they do that so that when they're actually beaming you with the radiation, you don't move.
You're not moving, so you're very stationary, you're fixed.
Yeah, very stationary, very fixed. Another part of the treatment is when you first get into the pod during treatment, first thing they do is they stick a balloon up your rectum. And you say, oh my God, a balloon up my rectum, that must be awful. So Turns out it doesn't hurt at all. It's a little bit uncomfortable for about 7 seconds.
And why do they do that?
The reason, and then they fill it with water. The reason they do that is to separate out your prostate from your rectum so that they do not radiate your rectum. That's a good thing. You don't want to radiate your rectum.
So this radiation is hitting the prostate primarily, but also taking in a little bit of the area around it?
Yes, they take in, I think, I don't know exact numbers, that might be like a 1/4 inch around it. And that's to make sure that in case there's a few cells outside of the prostate, they get them also.
And once you're there in your pod, your canoe as you call it, how long are you actually there getting radiated?
Well, they have like four gantries. Each room that you're in is called a gantry, and they rotate. So if gantry 2's using the beam right now, then and I'm in gantry 3, then it may be about 2 minutes later, it'll be my turn. So then they beam me, and the beaming takes 45 to 60 seconds. So I'll just hear a little noise, beep, beep, beep. When the beeping stops, the guy comes back into the room, takes the balloon out. I leave the pod. I go back to the dressing room. I get dressed. I go about my business. I go to the gym. I go work out. I go to the swimming pool. I was there during the summer, so I went to the swimming pool. Plus, at Southern California, you could probably, I guess you could go to the swimming pool all the time. I don't know.
So you didn't feel anything?
Nothing.
Pain while you're getting
no
treatments?
Pain, no nothing.
Okay. All righty. So you did that for 9 weeks. You've come back now, and what's happening since? Any side effects?
Well, by the way, while I was there on the weekends, and my wife went with me for 6 of those 9 weeks because she's a teacher and she had to go back, we went sightseeing. So I saw lots of places along Melinda. I went to Lake Arrowhead, and I went to the Nixon Library and the Reagan Library and a few other places.
So
we went to L.A. on a tour. We went to San Diego. We went to the zoo.
Sounds like you had a radiation vacation.
I had a radiation vacation. I never would have done that. It was forced vacation, but I had a great time. Now, what was your question?
Well, what's happened since? That was some time ago. It's been almost 2 years now. Your PSA now, have you had any side effects? What's the story?
Well, my PSA originally before treatment had reached a high of 4. After treatment, I had to have my PSA taken 4 months later, and then every 6 months for 5 years. So that's where I am now. Every 6 months I get my PSA taken. So anyway, it went down from 4 to something like, I don't remember, 3.3 or something like that, and then it went down to 2.8 or something. Right now, I'm down to 1. My PSA is 1.2.
Okay.
And I'm about to have another PSA level test done in about another month.
Okay, so the trend is downward. That's what's
trend is downward. That's what's supposed to happen because it takes time to work. What happens is that the radiation kills the cells and prevents them from reproducing, and over time, that's what does the trick.
Okay. Now you've been very active in terms of helping others and giving presentations on this topic. Can you tell us a little bit about that support work that you're doing? You mentioned you're a member of the Brotherhood of the Balloon.
Absolutely. I also want to mention that I have had no side effects. I thought that's an important thing to mention. I'm a member of what's called the Brotherhood of the Balloon. That's because of the balloon, so that's why they use that name, B-O-B. And Bob Marchini, who's written a book, can I hold up the book now?
Yeah.
He wrote this book. You can beat prostate cancer, and you don't need surgery to do it. Great book, and it's on his website. You can go to his website, www.protonbob, protonbob.com. You can buy the book. You get all kinds of information. Also, on his website, you can look at testimonials. They have a bunch of testimonials. I think I'm the last testimonial. And you can read my story because as part of the support group in Loma Linda, they had weekly support meetings. And when it's your last week in Loma Linda, they ask you to say a few words. So I gave a graduation speech, we call it. I call it a graduation speech. And mine was so good that they decided to publish it as my testimonial.
Okay. Well, Allan, we know, as you said earlier in the show, you're not a physician, you're not a medical expert. Everything you're telling us today is not intended to be medical advice. You're just sharing with us the information from your own experience. Could you tell us, however, though, is there anything special that anyone can do to maybe minimize the risk of getting prostate cancer or at least detecting it early?
Well, they say if you are active, if you work out, you exercise, if you eat right, maybe reduce your meat intake, eat a lot of vegetables, things of that nature, that will help. Take vitamins. But for most people, a lot of it's due to heredity. It's your background, it's your heredity. You might get it just because of that. The key thing is to be aware of it and to have physical exams, have your PSA done, checked every year. It's a simple blood test. You don't feel anything. It's a blood test. Have that checked every year, and also have a DRE. They're recommending now that you have it done maybe at age 45 because they're seeing more and more cases of prostate cancer at earlier ages. If you have a history in your family, you might want to start doing it at age 40.
All right, now you are active, you are willing, you told me, to give presentations or talk to people on this subject. Can you tell our listeners and our viewers how they can contact you and reach you if they would like to talk to you?
Sure, I'd be happy to talk to anybody. If you or anybody you know comes down with prostate cancer, have them send me an email or give me a call. My email address is Allan, ALLAN, .Kaufman, KAU, as in Frank, MAN, at Comcast, COMCAST.net. It'll be on the screen. You'll be able to see it. Allan.Kaufman at Comcast.net. And my phone number is 410-363-0080. And I'd be happy to talk to anybody who needs information. I'm a whirlwind of information. Anybody who contacts me who has this problem, I usually end up talking to them for a while, and then I send them because my view is it's better if you have it, it's better to take care of it right away, get it over with. And my goal is to inform people so that you can make a wise decision, knowing that it's your decision. Whatever it is, it's your decision, and you have to make your own decision and live with the results of your decision. My goal is to supply information.
Allan, thank you again very much for sharing with us today here on Speakeasy. About a year ago, I also was diagnosed with prostate cancer, and Allan Kaufman made available to me the information about all the various treatment options, and I did also my own research. I chose proton radiation therapy at the Loma Linda Medical Center for the reasons that Allan mentioned, and I have experienced the same positive results. Our experience, of course, is just one way to deal with the disease. Any treatment decision should be made in consultation with a physician, urologist, or radiation oncologist. The final treatment decision, though, should be yours. So learn as much as you can about the treatment options, the probable results, and any expected side effects. It's an important decision you'll be living with the rest of your life. My thanks again to Allan Kaufman for sharing his story with us today on Speakeasy. Till next time, speak easy